Good morning, good afternoon, and good evening to everyone. Thank you for joining our live, LinkedIn Live for Women Lift Health. A huge warm welcome to all of those who are actually joining us for this important conversation. My name is Akona Changela. I am the Southern African and Interim East Africa Director for Women Lift Health, and I have the privilege of moderating today's dialogue. So before we begin, I'd like to definitely extend my sincere gratitude and thanks to our esteemed panelists. Professor Sumeshni Govender, if you would just raise and wave and just say hi to everyone. Professor Glenda Gray, Dr. Ruth Labode, as well as Dr. Margarete Munakampe. Each woman brings her powerful experience, leadership, and passion to the table. And I'd also like to acknowledge all of you, our audience, for making the time to join this LinkedIn Live event, regardless of all of our technical difficulties. Really, your presence reflects a shared commitment to advancing women's leadership in health across Southern Africa, as well as beyond to the globe. Please remember to keep the conversation going on social media using the official hashtags, hashtag Women Leading Public Health, hashtag SASA Reports, and tagging @Women Lift Health across all platforms. Now to the reports. So this report really, and it's taken some time for us to really publish it, but it really provides a fresh insights into the state of women's leadership in public health across 10 of our Southern African countries, also including the opportunities, challenges, as well as systemic barriers that women face in stepping into and thriving in leadership roles. So despite progress in gender equity within the region, the report still highlights that many women across the region still encounter cultural, institutional, and societal obstacles that limit their full leadership potential. And at the same time, we see emerging possibilities, such as shifting policies, growing mentorship networks, and leadership development initiatives that are paving the way for transformative change. So in this session, we'll unpack these findings with the help of our remarkable all-women panel. We'll hear their lived experiences, reflections on leadership, and bold visions for shaping the future of health systems in Southern Africa. Our aim today is to not only to discuss, but to also inspire action, provoke fresh thinking, and imagine what's possible when women actually lead. So give me a moment to introduce the panelists. These are our esteemed guests, so I will take each moment really to recognize them and celebrate them. And so speaking of the power and impact of remarkable women leaders, we have our first panelist, Sumeshni Govender, as I had already introduced her. She's an associate professor and educational psychologist at the University of Zululand, as well as she is actually one of our inaugural cohort members for the Southern African Signature Leadership Journey within Women Lift Health. Her main focus is mental health, gender equity in education, and leadership development in Southern Africa. Professor Govender's areas of expertise include childhood and adolescent behavior, inclusive and special needs education, HIV/AIDS, grief and bereavement, and global coherence. She is an active researcher and academic mentor, publishing in peer-reviewed journals, presenting at national and international conferences, and supervising master's and doctoral research. She also serves as an external examiner for postgraduate programs across institutions. Once again, Prof. Govender, from here forwards, you'll be called Sumeshni. Welcome to the panel. Prof. Glenda Gray, first female president of the Southern African Medical Research Council, SAMRC, Chief Scientific Officer, currently Officer of the President, still within SAMRC. She is also one of our mentors within the Southern African Leadership Journey for Women Lift Health, and has strong focus in scientific leadership, public health research, and health systems strengthening. She is globally recognized leader in infectious diseases, medical research, and public health. She is the director of the Infectious Disease and Oncology Research Institute at the Wits University, Wits Witwatersrand, for those who are not clear on that, and the former president and CEO of SAMRC. An internationally renowned HIV researcher, Prof. Gray serves as co-principal investigator of the NIH-funded HIV Vaccine Trials Network and leads the brilliant consortium advancing HIV vaccine development in Africa. Her leadership extends to global health governance, where she chairs the Global Antibiotic R&D Partnership board and serves on the boards of the National Research Foundation and the University of Cape Town Council. Prof. Gray is a member of the Southern African and World Academies of Science and the U.S. National Academy of Medicine. Among her many accolades, and I think I will stop here, are the Order of Mapu Gumbwe for her work in preventing pediatric HIV, the Nelson Mandela Health and Human Rights Award, and recognition by Time and Forbes magazine as one of the world's most influential women in science and health. Help me welcome, wherever you are, Professor Gray, who I will definitely be referring to as Glenda from Hereford. And then we've got Dr. Ruth Labode, who is our commissioner for the Lancet Global Health Commission on Universal Healthcare. Also a member of parliament within Zimbabwe. She is our project reviewers for our Women Lift Health women cohort within the Southern African Leadership Project. And her main focus is health policy, universal health coverage, and governance in public health. Dr. Ruth Labode is a seasoned public health leader and passionate advocate for sexual and reproductive health rights. She made history as Zimbabwe's first female provincial medical director and later served as a member of parliament, where she chaired the Health and Child Care Committee and led regional efforts against tuberculosis. Dr. Labode has also, with medical and public health degrees from Bulgaria and the UK, has driven impactful regional initiatives, including UNDP's linking policy to programming projects, improving health outcomes for young people across Southern Africa. A former She Decides global champion, she now serves as, like I said previously, the commissioner for the Lancet Global Health Commission on Universal Health Care. A resounding welcome, Dr. Ruth Labode, and from here on, I will be definitely referring to you as Ruth. Last but not least, we have Dr. Margarete Munakampe, who is the Managing Director for Yakini Health Research Institute, Policy and Planning Manager, Women in Global Health, Zambia. So she works also supporting women in global health. She is a lecturer researcher at the University of Zambia, her main focus being health systems research, policy development, and women's health leadership. Dr. Margarete Munakampe is the managing director, as I previously said. She has vast experience in conducting interdisciplinary research on health policy, SRHR, mental health, early childhood development, and social protection. And she will also be the one actually presenting the results of the SASA report to us all. Over to you, Dr. Margarete.
Thank you so much, Akona. I'll just take you through some of the findings from the stakeholder analysis that we undertook. Thank you so much, Akona, for that warm introduction, and also very happy to share this platform with so many amazing women. As we may already know, Women Lift Health since 2019 is committed to expanding the influence of talented women within global health. And they've established hubs within North America, South Asia, East Africa, and also Southern Africa now. So to do a lot of work that includes supporting health institutions and their leaders to advance gender equity. So to achieve this mission, they decided to expand their work to the Southern Africa region and to mainly 10 countries. That includes Angola, Botswana, Eswatini, Lesotho, Namibia, Malawi, Mozambique, South Africa, Zambia, and Zimbabwe. The main thing really was to do a stakeholder analysis within these country contexts to inform programming for Women Lived Health. And that's where we came in as researchers, ADZIM Developments, Yakini Health Research Institute, and also working closely with BIXO, a research and consulting company that works closely with Women Lived Health. Together, we did stakeholder analysis to incorporate the voices of current and emerging leaders in the region. So the main thing that we were trying to find out in this stakeholder analysis was the overall status of women's leadership in public health and to find out what factors were really shaping women's leadership in the sub-region. So most of what we'll talk about will really be touching on that. We also sought to identify the barriers and enablers around women's leadership in public health and to bring out current efforts that have shaped women's leadership. That includes issues to do with diversity, inclusion within these institutions, like how well have institutions accommodated women leaders or women in general. We also explored existing opportunities or recommendations that would be useful for Women Lived Health across these 10 regions. So in order to really put all that information together, we started with reviewing existing literature about women's leadership in the sub-region, but also specifically for each one of those countries, just a unique profile about women leadership, starting broadly from, political leadership and narrowing it down to public health or the health space. We also then did a stakeholder mapping activity. So we went into all these countries and identified men and women, mid-level, senior level, operating in different institutions in the global health space. That included academia, NGOs, the government, ministries of health, and all these different players within the global health space that were basically influential in each of these countries. After that, we also did some interviews, some one-on-one interviews with senior level men and women, and also mid-level women to understand more issues around barriers and facilitators and the overall status of women's leadership in the region, and specifically in those countries. We also did an online survey, which we administered only to mid-level women in the different organizations that we had shortlisted during the stakeholder mapping. We basically put all this information together and presented it in the report that's now available online. I think you could access it if you went to the Women Lift Health website. So we have a full report and also a 3-page summary. But for the few minutes I'll talk here today, I'll just focus a lot on the barriers and facilitators, just to give the landscape of some of the discussions we had and some of the information we got. But please feel free to read the full report and also the summary report. So to just unpack some of the barriers we identified in our study, it's amazing that we're opening this with patriarchy and patriarchal social structures, because just the view that men were better leaders than women, I think it really shaped the context, because sometimes this is what affects women in leadership. They get judged differently. Even the consequences for some of the actions and decisions they make are actually impacted by patriarchal social structures, because they have this view that men should be prioritized as leaders, whether it's at home, in the community, and this has really undermined women's leadership aspirations in many institutions. across the context, we also noted the impacts of colonialism. And we're seeing lasting impacts because, as we all know, we are way past that stage. But then a lot of racial and gendered impacts of colonialism have continued to permeate our social systems, and for some contexts, been worse than others. So while women are fighting some of these remnants of inequality, they also get an added burden of fighting for their rights also as women. So it's just a little more taxing for women to push for some of their leadership goals because of this legacy that we have in our context. Another key issue that we noticed was the obligations at home, family obligations or responsibilities, because women bear the burden of family care in their homes. And so the fact that they're not trying to trade off their roles at home for their career, the fact that they're trying to do both, the fact that care is it sometimes competes with career aspirations. And so that double burden also led women to sometimes shelve their aspirations for leadership because they needed more support. They didn't want to feel like they picked their career over their families. So when we come to this issue of policy and efforts by institutions or by the government in the different countries to, you know, to sort of support their leadership aspirations, we noticed that even when there were policies on gender equality, on gender equity, they were not adequately implemented. There was poor implementation, and there was also low awareness of some of these enabling policies. And so at the national level, they would be there, but then not translated for institutions to take on. But then also within institutions, if people didn't know about these policies on gender equality, then that would be it. They were not being adequately operationalized. So we also noted overall in the broader socioeconomic context that the fight for leadership among women, it didn't just start within the workplace. There were a lot of barriers that were, preventing them from taking on these leadership roles and all. And they started from the communities. They started with girls dropping out of school early. They started with families prioritizing education of boys over girls. They started with high rates of unmet family planning and early marriages, all things that actually do take away from women's career goals because they go early into caregiving, into being there for their families and all. So these issues at the social cultural context, at this broader structural context, have continued to take away from women achieving their leadership goals. We also noticed that there were fewer opportunities for professional growth because they felt like they had less access to capacity building and knowledge opportunities such as trainings, fellowships, and conferences. And so even when they had access to some of these opportunities, it meant that they had to go into really seeing if they could go for a conference, they could go for a fellowship. And after they've dealt with maybe their household obligations or where do I leave my kids and who will take care of them and all that. So just we can see the caregiving roles coming back here and like taking away from some of the opportunities that women had. Again, with the background of viewing leadership as, something that's more suitable for men or more patriarchal, we noticed that this dominance did actually shape the landscape of public health because it just meant that there was more of a biased choice for leadership for men compared to women. It also impacted women's confidence in aspiring for some of these leadership roles. One other vice that I would like to highlight really is exposure to violence, gender-based violence within the workplace. And this one, I think, is something that women felt was coming from some of their peers and also some of their superiors or people who just held some authority over them. And whether it was psychological, verbal, or sexual violence, it just made the workplace a little unsafe, and it also hindered their morale and um, their desire to really push their leadership goals. So this is something that really, really impacted women in the workplace. On the other hand, while we noted a lot of barriers, we also highlighted a few things that we felt were more supportive of women in their leadership goals and their leadership aspirations. And one major thing we noted was that there were some targeted education and leadership programs, not just within the health sector, but generally in the different contexts, where people noted an increase in investments at the national level for women and girls and leadership development and what they're calling empowerment programs. And these aim to help women to prepare for future leadership positions, to just, give them a better sense of their agency and their capacity to take on leadership roles, starting all the way in high school, in university, and targeting younger women as well. So this was seen to really create an enabling environment for leadership for women. Some women also share that if there was a supportive environment in their homes from their partners and their family members, basically pitching in on some of those roles that they do have in their homes as well, whether it's actual work or general encouragement for some of their aspirations, they felt that this really was very useful in attaining and being successful in these leadership roles. At the more global level, we also noted that all these global movements that push more for gender equality have also been very instrumental in shaping the landscape for women's leadership. Movements such as the Me Too movement or the He for She movement brought on conversations about gender equality into the mainstream. So because people are talking more about gender equality, because people are talking about how women can achieve anything, can do anything. So it sort of gives room for people to talk about gender equality. And while we talk more about gender equality, we notice that global initiatives such as the Sustainable Development Goals were noted as a nice framework, a nice place to start if, as an organization, you decided to do more to improve the gender equity landscape. And so the presence of these standards were also seen as something that was useful in creating this enabling environment for women as leaders. For workplaces or institutions that were seen to be proactive or that had vocal leaders who pushed for gender equality, who pushed for women and supported women, these types of leaders were also really appreciated as enablers in this context because they really set the tone for the agenda or within the institution that helped women feel more supported, more valued, and more optimistic about their ability to grow as leaders. And so I think there was a lot of appreciation for such leaders within the workplace. There was also presence of strong institutional policies on equality. These I'll say inclusive policies around hiring, professional development, and promotions took on the barriers that women expressed head on, and they were able to create these more conducive environments within the workplace. But this, of course, wasn't in all the institutions that we had an interaction with. So for those that thought deeply about how to support women within the workplace, some of their institutional policies were much appreciated by the women in the study. Finally, on enablers, we also note that men as champions for women and gender equality were also appreciated because their efforts really supported gender equality in advocating for women and in aid initiatives that equip women with essential and technical leadership skills. And it also helped to sensitize other men to support gender equality. So from our survey, just to highlight some key findings, women did share top 4 existing enabling policies within the different institutions. And we can see that over 80% of the women who we included in the online survey said having paid maternity leave was a key enabling policy within the institution. While flexible work schedules were also mentioned, formal support networks or programs, and also pay equity policies, these did not rank as high as paid maternity leave. So we can really see how appreciated the paid maternity leave was. for women we included in the survey. Also to mention that over 70% of the women we surveyed were highly or somewhat confident in the ability to grow as a leader. So this, for me, just tells us that women want to be leaders. Women are ready to be leaders. So how can we support women to be the good leaders that they can be? Looking at all the findings we got from the study, we also highlighted a few program recommendations for women with health, according to the people that we talked to in this work, in this study. And they did suggest that women with health needed to focus on content that would shape confidence building among women, and also to focus on strategies for navigating patriarchy, because I think this was an overarching theme across contexts, and particularly for this region. There was a need to really focus on how do we navigate patriarchy within our institutions as leaders. There was also a feeling that we needed more policies that support the work-life balance. And a lot of women really talked about the work-life balance, how hard it is to navigate work and other obligations. Another key recommendation was to really redefine leadership using the lived experiences of women. So when we have more women as leaders, reflecting on their own lives and their own experiences, and allowing that to shape how we to shape some of our policies within institutions, I think that was much appreciated by the women in the study. And so that was a key recommendation also. There was also a need to strengthen both physical and virtual networks, especially for rural women who we know do not have as much access to virtual platforms, even one such as this one we're having right now. And so they would, in that space, be systemically left out. And so there is a need to strengthen some of these spaces for women who may not have access to these spaces all by themselves. And finally, to also incorporate legal and policy literacy into training, because we did note that a lot of people were not very aware of some of the enabling policies, whether it was at the national level or within the institutions. Seeing that this study was done across 10 country contexts, we also tried to see some cross-country recommendations that would be useful for women with health. And among them, there was a need to help women develop institutional gender strategies. So there is some indication that some of these policies exist or strategies exist, but then there was a need to really look into what's there and see how it can be better done, leveraging the different country experiences and what has worked and what has been successful. There was also a need to advocate for inclusive, gender equitable policies. We were able to see these in some institutions. So if other people can do it, then they are definitely doable, and everybody would actually benefit from that. We also recommend encouraging GBV safe reporting and disclosure mechanisms because of some of those gender-based violence related experiences that women shared. We needed to strengthen reporting and disclosure and how that whole process can be managed. Another cross-country recommendation was to create mentorship links with early career women. A lot of women did share how difficult it was to know when they became mid-career women or when they became senior career women. So it's something that those changes and also those connections across career levels are really necessary, and they would be instrumental for all the different women. There was also a feel that we could engage men more in leadership programs, as we saw the influence of supportive men at home and also supportive men in the workplace. There was a need to engage with men more because this was seen really as an enabling factor. Where it has worked, I think we could pick best practices and shape the landscape for women's leadership across the context. And finally, there was also a feel that we needed to be, women lived health needed to be more inclusive of the Lusophone countries in the sub-region, particularly Angola and Mozambique, because they were part of the 10 countries that were selected in this study. And so the language barrier is a key consideration and should be looked into. So thank you so much. I'll pause here and allow the conversation to continue. But thank you so much, Akwana, for this opportunity, and I'll hand over back to you.
Thank you so much, Margaret. The report really paints a clear, vivid picture of deeply embedded barriers, but not only barriers, but it also highlights the enablers, opportunities, as well as possibilities of what we can do as women leaders within Southern Africa, with, of course, the support of our male counterparts. Now we're going to go into our panel discussion. I'm going to reach out to each one of you and ask you the first question, to please also just share your own personal lived experiences, as well as the country-specific insights. You're all coming in from different countries within Southern Africa, and we'll be really grateful to really hear your points of view in that direction. I'll start asking Glenda. So Glenda, in your experience, what is the most invisible but powerful barrier women face in stepping into leadership roles in public health?
So I think there are two things. There is this glass ceiling that women face. And for Black women, there's a double glass ceiling. So they are doubly prejudiced about moving into leadership in the institutions. And so I do think that this lasting impact of colonialism needs to be understood. So I think that's the one issue. Other issue is I also agree that women are often judged differently. So women leaders are seen, as you'd call a male leader assertive, and you'd call a female leader aggressive. And I think so that's just the way we are viewed in leadership. And women have, if you are a woman leader, often they are discriminatory or stigmatizing terms like career woman. We don't have a term called career man. And, why do we call someone who's a woman a career woman? She's a career woman, which denotes, has a negative statement. But I think one of the biggest problems, there are two big things that concern me. And I'm surprised that it wasn't raised as this pay equity thing. And so women leaders do get paid less than male leaders. And we need to address this pay equity. And there should be equal pay for equal work, irrespective of gender. And that's a big thing that institutions can do. And just my final point on this is the issue of imposter syndrome. So a lot of women feel that they are imposters. They get appointed as head of department, and maybe they're young and talented, and then someone will say, "Oh, she got the job because she was a woman, or she got the job because she was a Black woman," where in fact she got the job because she was brilliant. And so women have a lot of work to do around addressing the issues of imposter, and how we help women in these roles to address this inner stigma of imposter syndrome, which sometimes can compound that. And then just finally, the importance of networking. So I found that what we don't do good as women is setting up networks for other women. Men meet in pubs, they meet on the golf course, they have their structures, and they support their fellow men and their fellow friends' sons. And in the same way, women need to build these kind of networks for each other, and how we can find ways of supporting women in a network as men do. So we need to learn a lot from men. And I think that one of the biggest things is the issue of networking, and how we make sure that we as good as networking in our female structures as men are in their male structures. So I'll finish there.
Thank you very much, Glenda. Very insightful perspectives. Sumeshni, I'll go right over to you to ask you the same question. What is the most invisible but powerful barrier women face in stepping into leadership roles?
Akona, thank you to you and Women Lift Health for the opportunity to speak with such wonderful women, powerful women. And I have to agree with everything that Prof. Glenda has said. It's been amazing. listening to her speak because I couldn't agree more. But something that I would like to highlight is the power of language and how we've eternalized everything that we hear. Language is such a impactful structure, and I believe that it sets most women up for failure, very similar to colonialism. And on the continent, we've never had a need for balance as we call it in the past. You know, we've always lived in symmetry with everything, nature, the planet, the environment. And then now we keep talking about this balance. And, you know, I don't like the word balance. I like the word harmony. And how much I insisted on using the word harmony when we met for immersion. Because I don't think there is such a thing as work-life balance. And I think it's about just each person finding that harmony and being able to live harmoniously with your work and your life. And that's why I think language is so powerful, because just finding the right words all the time. And for me, every time you find yourself, even at work, the language that we use has been so powerful, you know. So I think for me, it's been about language all the time. Even the enablers that we discuss in the report, you'll find that twice women spoke about needing support from men. And I know this is going to make me extremely unpopular. This is not a popular position to take, but I feel that we enfranchising ourselves when we constantly say that we need the support from men. You will never find a male leader saying, "Oh, I'd like the support from all the women in my team. I want the women behind me." You know, he'll just say, "I'd like my team behind me." But as female leaders, we are always asking, can I have some males behind me? You know, I want male allies. I want men to support me. I want the man of the house to support me. And there were two enablers asking for men to support us. And that is about the language we use. We should say we want our partners to support us. And we want other stakeholders to support us. It's about the language that we're using again. And why? Because we need to be validated. We want to be validated. We want men to say that we deserve to be in powers of position. Why? Why do other people have to make us feel like we deserve those powers of position, you know? So again, it comes back to language, the way policy is worded, the way everything is put into language. So for me, it's always been about language. And I'm going to say that everything boils down to language as far as I'm concerned. And when I look at all the barriers, everything, it came down to language, and even emotion came down to language. Every barrier I looked at and I unpacked, I felt it came down to the language we used in those barriers. So I think I'm going to stop there because I get so emotional when I look at the language, and then it carries me off at a tangent and I start talking about the psychology of it. So I'm going to better stop me, Akona.
Thanks, Sumeshni. Really appreciate it. So from all of you, we've heard language, we've heard GBV challenges, we've heard imposter syndrome, we've heard all the barriers that we all face when we're trying to get to leadership roles as women. So Margaret, I'm not going to ask you the same question, but particularly ask you, what surprised you the most when you were looking at all of this data and looking at the findings? What really did surprise you the most from this analysis, if you may?
That's a really good question, Akona, because I think coming into this study, it felt like we knew much about some of the barriers and enablers that women had within the context, though not many studies have actually gone in to really understand what people are doing, how people are navigating these spaces. But just really doing it for the first time, really sitting in an interview with women, different women and men, and unpacking some of these issues, that was a really good experience. I think for me, there was this feel that I would add myself as a woman, yeah, fortunately, unfortunately, I don't know, because I can't really change. But yeah, it felt as if we as women have sort of accepted some of the barriers, some of the challenges, some of the, the work-life issue, the fact that you're striving with men, the fact that you're not really getting the support you need. It just felt as if a lot of women had accepted that, environment, that context, and almost like there wasn't much that could be done. You could hear a lot of inspirational policies in some of the institutions where women were working, where they gave them time to be with their families. They gave them pay even when they had these competing obligations at home. And so it was also striking to see that other organizations were actually very proactive about this, and they had actually done something to encourage women. While for some, this wasn't on the table. So I think for me that those two kind of struck me, because on one end, there's this high level of complacency, while ironically on the other end, there are people who've done quite a bit to accommodate women and to really encourage them to take on more within the workplace. So yeah, I think I could highlight those two. Thanks, Akon.
Thanks, Margaret. Going back to you, Ruth, as a parliamentarian as well, and I think this is really the right question to really ask you around what patterns of power dynamics stood out across all of the countries when you read the report.
The patterns of power dynamics that actually I observed, for me, it is the first one, like everybody has said, is the cultural and religious expectations which define a woman as one who is married and one who puts her husband and children before her career. And I noted that this unconscious bias has moved into boardrooms and workplaces where men now perceive women as their wives. They should treat you not necessarily that you sleep with them, but rather that you are a woman. And I observed that we tend to undermine some of the very, very important issues, especially stunted opportunities for education, which currently is leading, because girls are out of school because of poverty. Girls are out of school because they've dropped out, because they are pregnant. We have literally an epidemic of teenage pregnancies. And we do not have a group of women that tomorrow we will be able to fight for positions, because this generation is dying from all sorts of different, especially the women. They are becoming statistics of maternal mortality through unsafe abortions, child marriages. Those are the things that really bothered me, and we ignore the draconian laws. Nobody in the region, in the SADC region, only 4 countries have improved access to sexual reproductive health for the adolescents. The rest, we are sitting on draconian laws that stop girls from going to seek some of these facilities. And it's so sad, even where, like Zimbabwe, where we have actually passed a law saying sexuality to be taught in schools through the comprehensive sexual education. We still have not trained the teacher yesterday on SRH. So it just becomes like how can I put it, almost a tokenism. So I believe that civil society together with parliament in the SADC region should work hard at repealing or even removing total all laws that restrict access to SRH services through age limit. This is why we have a very high unmet need on family planning. leading to teenage pregnancies.
Thank you, Ruth. Very inspirational, very passionate response there coming from you. I'm also curious also to see if, I know, Sumeshni, you touched on this in terms of language, and one thing that came out of the report was that language barrier, even when we reached out to Mozambique and Angola, that usually is almost like a hindrance in terms of how we can excel and interact as women, never mind being leaders. But I also wonder, if you may, Sumeshni, are there any voices or perspectives you feel were underrepresented and needed to be brought forward? And why?
Definitely, I think so. As much as I'm saying we don't need to be validated by men, I think it would be lovely to find out how they feel about women leaders. It wouldn't hurt to find out, what's your take on women leaders? How are they performing? Because I've been looking at research about women leaders and they're doing exceptionally well. I mean, there was a scoping review done this year alone with 137 articles that showed that women leaders were outdoing themselves. It was done by Karl Barkaisk, I think it is. That's how you pronounce his name, the main researcher's name. But a brilliant study, lots of, it's a tabletop study, but it was an amazing study to look at all these articles looking at women leaders in global health and how exceptional women leaders are performing in global health. But now let's look at how, if we believe the opposite gender we need their input. Let's see how they feel about us as female leaders in health. Yes, by all means, ask other people how they feel about female leaders. Because look, the one thing I love about being a part of Women Lift Health, it's not just lifting women, it's about women lifting women. That's what I'm talking about when it comes to language. It's about also how you do what you do, It's not just doing something, but also how you're doing it, how you go about doing it. It's that a sense of being empowered, but empowering yourself. So there's all this nuances to it. The whole thing is, if you really want to do more, and that's the nice thing about the program, is getting male allies in as well. The report is looking at male allies. Let's add that dimension. Do further research in terms of male allies. How do they find female leaders in global health? What's the strengths we can take away from that? And even little things, like, for example, the difference between equality and equity. For me, the terminology is used interchangeably, but I don't see it interchangeably. So there are these little differences, these subtle differences that we have to look at moving forward. So I think that there are little things that we have to include when we move forward with the whole process. So there are little things that I think as a whole, the report is so dynamic. It's huge, and there's so much for us to really look at. And if there's anything we do, it's going to be just little things that needs to be tweaked.
Thank you, Sumeshni. So Glenda, having all your ample experience in terms of running organizations, and also looking at, based on the report, what should be on top of our minds for institutions working to advance women's leadership? And also, I'll be curious to hear what challenges that you found, and if there was anything that you implemented within the various institutions that you've also led.
So I think first thing is equal pay for equal work. And that's an important thing. So although the report didn't highlight that, people were more, maybe because it was mid-level careers, they were more concerned about paid maternity benefits, which should be a fundamental right for every woman to have a paid maternity. But I do think, that we have to insist that there's transparency in pay scales and that women get paid as well as men. And sometimes there's lack of transparency at senior levels where women will find themselves getting paid much less than men for the same job. So I think that's an important component about equalizing the playing fields. And then I think also what's very important is to understand so how women are judged in their leadership roles. And then I do think that where I benefited from was to have coaching, to spend a lot of time with my team so I could understand their own issues. We did psychometric testing so that I could understand, what were their drivers. So when a male counterpart would challenge me, I think he had a problem with female leadership, and actually it wasn't about that. He had other issues around being not liking, being a person that didn't like leadership. And then by putting him in a different role, he thrived in his new position. So it's about understanding how your team and profiling your team so that you can optimize the way you work with everybody. So I think that's a very important thing. And also to make sure that you as a leader are getting the professional coaching that you need so that you can bounce things off and speak to someone who's independent about some of the feedback you're getting from your team or the pushback you're getting from your team. And so I do agree that women are judged differently. And so we do work much harder. We have more insight, we're more reflective, we care a lot about our leadership. And I think that's an important part of helping to support and mentor other women. So when I do some mentoring with other women and they come into my office and they have all the same issues that I had as a young leader, and about being taken seriously as a young woman in your 30s, about people not appreciating you, thinking you just got it because of where you are. So I think we have to be very mindful of supporting other women. So yeah, we can ask men to support us, but we need women to support us as well, because often in these areas, women are not supporting other women, and that's critical in terms of leadership. We should not try and annihilate other women around us, but try and work with them and support them so that we can all grow together.
Thank you, Glenda. Very valid points, especially around intergenerational support and making sure we all really grow together. And so, Ruth, if I may ask, what role do individual women leaders and male allies play in changing leadership pathways for women? We've heard how important it is to have our male allies. And I think also just specifically in terms of really being able to share the challenges that we have with our male allies. And I see that we have quite a number of those in the chat, really sharing their perspectives. And I appreciate that, men. Before you answer as well, Ruth, I just want to also highlight in the LinkedIn, please ask your questions. We will share them with the panelists for them to actually answer in the next 10 minutes. So Ruth, over to you. What role do individual women leaders and male allies play in changing leadership pathways for women?
Men and women allies operate in three forms as far as I'm concerned. They are either very supportive and they have what is called lifter up syndrome, where they actually, I have been lifted. For me to have actually attained the position of the first woman provincial medical director is because when I went for an interview, which I was afraid to go, by the way, because of imposter syndrome, the woman who was chairing the committee that was interviewing, the minute she saw me, she gave me this broad smile and said, "Go girl." This was 1993. Think about it. She said that word and I cooled down and I felt motivated. We do have a lot of men that actually will take people on merit, because as a leader, you also want to know when you're not at work, the right person is doing the job. It is rare, but it does happen. That is the lift her up syndrome. Then you have the pull her down syndrome, where men and women, mostly men, will mobilize. If you are put in a leadership position, they will mobilize against you. As a female leader, they will even write petitions against you. In fact, this is even more common now among civil society organizations. I have 2 cases which are in court where directors of organizations were falsely accused of having done some malicious misconduct of some kind, and the cases are falling down in court. Then you have another syndrome, which is called user, a situation where they put you in a job because they want, until they are able to find the right person, you act in a position, but they know who they are going to put there. So how can men, both men and women, help each other or help us as women? Mentorship programs. I strongly believe in mentorship programs for subordinates. And I've always endeavored not to leave a scar where I've worked, but to leave a legacy. And also to sponsor if it needs me, literally looking for a sponsorship for my subordinate to attend an international conference, for example. Because I personally, I'm really shocked that some of these leaders who are women leaders in women development organizations have attended the CSW 10 times, which means for the last 10 years, and none of their juniors has ever been there. That is a shame, a really shame, because it means we are not growing ourselves. We are staying as a coach of people who go to CSW or World Health Organization, the WA, or even the International AIDS Association. These are big health conferences where once in a blue moon, either as a man or a female manager, endeavor to send one of your juniors. So it grows you, it grows the person can learn to write an abstract and it changes them. So I really believe that men are greedy, that is very clear. And they will try as much as possible to oppress a woman. But they are also not stupid. If they think you are capable, they will try to use you. And while they are using you, learn as much as you can, because they will meet you at the interview for the same position. Thank you.
Thank you very much, Ruth, for your insights, especially around mentorship and ensuring that up-and-coming leaders also get the opportunities to also be part and parcel of the interactions and engagements and putting them in that on those seats and tables. Looking at a more societal perspective, Margaret, what role do you think our communities then, as well as the networks, can play in changing leadership pathways for women?
I think basing much on some of the discussions we had in the study and also just my personal experiences, I think there was this, a lot of women shared experiences of the barriers. I think barriers are much, much louder than the enablers in this study. So a lot of women shared experiences of what happened to them, how, they were unfairly treated, how something happened, and you could feel these experiences. But then what do we do when these things happen? What actions do we take? What are we entitled to? What can we do? I think there wasn't much on that. And so we see women struggling, but then that's it. You're aware of the problem, but then you're not really aware on what to do, how to handle it. You're sitting in your workplace and you're told a man will be promoted over you because he's got a family and children, and you don't. So you need to hold back and wait a little bit. So what do you do when that happens? So this comes to issues of awareness, people understanding what they're entitled to and understanding exactly how to claim it within the workplace. And also just supporting women to be empowered enough to claim these, to claim this action when they're facing these issues, because we've all agreed that these things are happening, but what are we agreeing on how to deal with these issues? How do we challenge these issues when we face them in our everyday life? So I feel our communities can really come in and help with increasing awareness, help with supporting women so that we don't get harshly treated the moment we decide to claim our right to a promotion, because we deserve it. It's on merit, and it's only being taken away because of a gender-related reason. It just means we need to normalize such an action and not really taint it with poor leadership decisions. And to also increase spaces for networking, because on one end, you're seeing organizations really looking into this space and doing something about it, while others can't do anything about it. So sharing experiences, I think whether it's done in a mentorship program, whether it's done in some cross-sector collaboration, but sharing of knowledge and experiences and information about what's working elsewhere, and trying to increase that base, that knowledge base, that experience base, so that we can actually, change the context and learn more from what is working and some of the best practices. We can't know what works if we don't know what other organizations are doing. So just sharing experiences and sharing lessons. And also, I think we are constantly hearing the value of women supporting women. We are consistently understanding that we do need to support women. That support is needed, but sometimes what does support mean? What does it really mean? And so we need to also, in increasing awareness, there should also be an increase in an understanding of what support looks like, how support can be enacted in everyday, interactions, in everyday workspaces, just a bit more, a less passive stance at support, but a little more action oriented, and really seeing what support means, what support looks like, because we do understand what's there. We do understand what people are going through. But for me, there's a bit of darkness on what can be done. So just illuminating what action looks like, illuminating what support looks like, illuminating what standing up for what you're entitled to looks like, illuminating who a good woman leader is. That we need to do a bit more of that. And the community, different networks can really, put a hand and show us what that looks like. Because in doing that, we're also, changing the whole face of women leaders within our communities and within the context. I think that change is something that we should aspire for, and we should also just map out the action towards that change. So yeah, I would answer that question in that way, Akon. Thank you so much.
Thank you, Margaret. As we come to a close for our panel, and really thank you to all the women for bringing their lived experiences as well as their passion into the discussion. Just to remind those who are listening in or watching to please also just send in their questions if you have any, and the team will pass them over to the panelists, and we'll make sure that we can respond to them in the time given, or even at a later stage on the LinkedIn chat place. Just to ask all of you, in terms of if we were to conduct a study again, which we probably will, as Women Lift Health, and then also we invite you all as panelists in 5 years from now, what progress would you hope to see coming out from this report and today's conversation? So basically, what bold shifts need to happen to get us there? And we'll start with Sumeshni.
For me, Connor, change needs to be systemic. I can't see change just being in the workplace only. We often believe that it needs to be in places of employment alone. However, it needs to begin in our homes because gender roles start there. And it's a mindset shift. So it needs to start in our schools, the way we raise our children, the way we educate our children. And that starts with everything we do. So it's in our curriculum, it's in our sports clubs, it's in our all-boy clubs. It's through Women Lift and the women who are lifting each other, because like Dr. Ruth said, the draconian laws we set up for women holds women back. It's in the community-based gendered patterns that we see everywhere around us. There are patterns that hold women back and they don't even know it's happening. Like Prof. Glenda said, there are pay disparities and we don't even know it's happening. So we just accept it. You know, we say all we want is more maternity leave, because as mothers, our base need is our children's needs. We say we want equality, but that will never happen. It can never happen. It is not a possibility, because a man and a woman can never be equal. You can only be equal when a man can birth a child. He will never birth a child. I don't know if that's ever going to be a scientific possibility, maybe sometime in the distant future, you never know. But so there is no equality amongst the two genders. So what we're looking for is equity. We're not looking for equality. We do not want to be the same. Sameness is not the goal. And in 5 years, if we're still fighting for the same thing, then we are losing the fight. And that is the point that I would like to make. I don't think that we are going to be saying the same thing for 5 years as Women Lift Health, because I find it a progressive, a very active organization. And I know that it's making great strides. Being in the inaugural cohort, I can see the good work that it's doing. And I think in 5 years, we're going to see great changes coming. So yeah, I think that it has to be systemic. If it's only in the workplace, we won't see the changes we need. So systemic is the way to go.
Thanks, Sumeshni. The importance of systemic is really key. Ruth, over to you. 5 years' time, we're back having the same discussions. What bold shifts needs to happen to get us to that place that we need to get to?
5 years' time, I'm hoping we would have won with the 50-50 for parliamentary cabinet positions, 50-50 for parliamentary positions, even if it means we lobby for a political declaration at SADC level, at country level, to ensure that it's happening. It has happened, I think, in Namibia. It can be done. It's not that it's impossible. We lobby for it. And we also, so what needs to shift? A political declaration is required. And also an increase in finances for organization working for advancement of women leadership, both from the donors and domestic. Right now, we are sitting here. I know for sure there is a court case of Wilsa, women law in Southern Africa, where they've taken the Zimbabwean Minister of Justice and Health and said, allow the girls to abort if they get pregnant through a rape or even in an illegal relationship. The country has declared that if you are below 18 years, you should not be having sex. So it means if you have sex, that sex is a crime. So it should be removed. And it seems they are winning, because the first stage of the court, the judge said, yes, you are right. Constitutionally, it should be like that. So I'm hoping this one, in the next 5 years, will be there. We'll be talking of safe abortion for the adolescents. And also, I am definitely hoping, by the grace of God, that we would have reduced our unmet need to contraceptives to something like 1% for the region, because it's pathetic, you know.
Thank you, Ruth. Glenda, same thing. What's on your bucket list? What shifts do we need to do within the next 5 years? You come back and we discuss the same thing. What would have changed? And I also would like to pose the same question to the listeners and also those who are watching on LinkedIn Live. Please put it on the chat. What is our bucket list? What do we wish to happen in at least the next 5 years? Glenda, over to you.
It's all about us. So it's our job as women leaders to bring up more women leaders. And so we have to lift as we rise. And so my bucket list is that we come back here in 10 years and say, I don't have a job anymore because there are better women than me who've superseded us. So I do think it's about succession planning,
making sure that we manage talent properly and that we grow that next generation woman so that she can flourish in 5 years. So that's our job. And that's my bucket list, is commit myself to developing women in our region.
Brilliant. Thank you very much, Glenda. So we do have a few questions that have come in from our listeners. There was a question coming in from Jamal Ali, which I hope she is a male ally. And he was asking, what do you suggest to improve merit-based leadership? Then other affiliated factors-based promotion for leadership positions, specifically in public sector.
We have enough talented women on our continent and ready to become leaders. So I think we have to make sure that we enable and empower these women to take this post. Exactly what Dr. Ruth said when she went into that interview and she saw the other person smiling at her and saying, "Go girl." So I would suggest is that we don't need any adjustments. People think that women and meritocracy don't go together and that we have to somehow give women a chance because they don't deserve it. I believe that women deserve to be leaders, and I believe they're ready, and I believe that we don't need anything else but meritocracy, because we are going to beat men at their own jobs. We can do it, and we just need to be given the chance, and we need to believe in ourselves.
Thank you, Glenda. The other question that came in was, how can we ensure that women leaders don't just go through fellowship or programs, but actually get to practically put their skills to use in leadership roles while prioritizing their diverse communities and life stages? Margaret, I'm going to pose this one to you. You had really lovely insights earlier around this.
I think I'll also just try to reflect on the last question that you had asked while answering this one, because I was actually thinking through that it touches on what we want to see after, knowledge has been gained, after we're a bit more aware on what should be done, right? So I feel we should have more action now. When we should plan to act, we should plan to do something about these things. We should plan to redefine what it means to be a successful woman leader, the other day I was reading that there are about 28 women heads of state in the world. So can we understand what that means? Because leadership, we keep complaining that it's defined according to men and what men have defined as, leadership and what it should be and all. But I'm thinking 28 women, successful heads of state, what does that look like? And how can we aspire for that as women leaders? So we need to act a bit more and to see this landscape in a completely different way. And it's something that can be done, after we've been trained, after we've understood what's possible for women, after we've understood how leadership looks for women, after we have gained knowledge, after we've understood what can actually exist in our context, we can actually begin to unpack and understand. I know it takes quite a while to change norms in any context. These are things that will happen in the next generation. Some of us may not even be there when norms have completely changed. But then what can we do now? How can we act differently? And what opportunities are there for us to behave differently on a personal level, as people who've gone through some training, as people who've understood how different the landscape can look, as people who've experienced some of these barriers and really need to see something happening a bit different in our context. And so just, an understanding of what action looks like, what can we do in our spaces at home, in our communities, at work? What does real action look like without a total, without punishment for women after they've acted? Because that also happens to us, right? When you step out of the norm and, you really get punished for that. But what success is, not really getting any backlash for standing up for your rights or for doing something, for aspiring for leadership and all. So I think the main thing for me there is action. What does action look like? And how can we, head more into that direction so that we can actually know what to do when we are in these situations in our everyday experiences.
Thanks, Margaret. I heard action as well as shift the mindset. I think it's really important to have that shift in mindset as well. Sumeshni, you spoke a lot about work-life harmony and not balance. And so there's a question here coming in from Ruchika Aurora, who says, how should women be perceived productive with harmonious narratives against men leaders?
You know, if we're being judged by men, that's never going to happen because they have no concept, unless they're part of the process, about the demands of the lives we live. I mean, there are very few countries that make allowances for mothers with breastfeeding babies, taking care of geriatric parents, for example, because on this continent, we are multi-generational families living in one household, those type of things. And those make some of the most successful living circumstances, you know? So we need to ask ourselves, where does the burden fall when you're living under those circumstances? Men don't breastfeed, they don't run the household, they don't know what the feeding of a family looks like. Just today, I was sitting with someone in the morning and the phone rang. And she said, oh, my husband's asking what I made him for lunch. And because he has to go home and fetch it. And I didn't have time to do that. She's a working woman. He has a job, but it's her responsibility. So, you know, everybody has a career, but why is that task assigned to her? We have to ask ourselves, why have we certain assigned tasks to us as gender roles? Because we've allowed it. Why haven't we discussed these things when we've entered the partnership? And that's why I'm saying we have to talk about partners when we talk about these things. Because if it's a partnership, it means equal. You don't ever talk about equality. And now I'm saying not equity, I'm talking about equality when you talk to a partner. And that's the dynamic. So if we have to do that, I don't think we'll have a problem. And the harmony means that there's no such thing as balance, that one thing supersedes the other at different times in our life, and we have to accept that. Sometimes work gets the upper hand. Sometimes life gets the upper hand. You know, I'm at the stage in my life where your child is older, so work may be at the top. Or if you have younger children, your children gets the better. So that's what harmony means. Whatever deserves the best of you gets the best of you. And we need to understand that. So harmony means whatever deserves the best of you gets the best of you. So balance means everything gets the best of you, and that's not humanly possible. So we need to understand how we use our terminology, our phrases, understanding ourselves, understanding each other, and also making the allowances for each other. And if we do that, then we will care for each other better in the workplace as well. And that's absolutely vital. I think the last thing I'd like to end with is that I think women have to constantly prove themselves competent in the workplace and consistently perform despite the challenges. And that's the saddest thing for me. That's not always true for men.
Thanks, Sumeshni. Thank you very much. So I am tempted to ask one last question to Margaret, and then we close, because if we don't close, we'll be here the whole day. I'm looking at the chat and I'm seeing all the very animated responses. And just to tell the panelists, everyone is enjoying this interaction, because I'm sure you can't say it unless you actually join as a participant. And so please, Margaret, one question, and if you could just close, being the first one to open for us, being the one who actually did this research for us. And then also just close with this question coming from Ora Beleng, saying, how do we break through the pacifying she policies that create a facade that more women are being hired into leadership positions when it's actually still a very small fraction of women who are actually at leadership positions? So we've got the policies, but we are just not reaching there. Margaret, over to you.
Thank you so much for that. And I'm not really sure I have the answer to that, to be honest. But you know, just reflecting through a lot of the barriers that women expressed in the study, you know, the overall patriarchal, you know, influence in the context, looking at navigating family obligations with work, navigating experiences such as violence within the workplace. And there are a lot of things that are deterring women from being in that pool that you're talking about, being in the pool of capable women. So it doesn't start from, you know, that pool. It starts from before that pool even exists. It starts in our communities. It starts in how we're treating women in our homes and in our own families. It starts with how to create that environment that will actually increase the pool of women leaders that we can actually pick from. And also understanding who a woman leader is. I'll just say that to echo it again, because this view of who a leader is not completely a reflection of who a successful woman leader is. And so if we began to see that woman a bit more, we would actually also see a lot more capable women within our context, because leadership for women comes with a lot of judgment. It comes with a lot of dissecting of decisions that women make. Even when a woman leader makes a mistake, the consequence that she would face compared to a male counterpart would actually be very different, because the bar is actually raised much higher for the woman. And so if we're able to see that those biases, if we're able to understand that a lot of women are actually capable of being leaders, but there are a lot of barriers that really come into our way of seeing that, even coming to the way of women seeing themselves as leaders and not aspiring for more leadership positions. So I think the barriers really sound louder than the enablers, but we can't really, you know, feel as if there's nothing that we can do. Let's support women. Let's support women to reach that pool so that we may have a lot more women to pick from as leaders. And we keep saying there are fewer women leaders, but it's also a much better landscape compared to what it was in the past. And so this is a slow change that we're noticing, but then there has been some improvement, meaning action is effective and there is more action to be done so that we can see a context that we are actually more proud of when it comes to supporting women in leadership. So we do highlight some things that can be done in the report, you know, knowledge sharing, leveraging existing policy. There are some things that can be done now. There are some things that will take a while to do. There are some things that will happen in the short term, but overall there is action that can be done at whatever stage, and we should focus more on that and see exactly how to enact some of these changes that we would like to see so that we can actually influence our context. And just to I'm just happy that Women Lift Health has taken this initiative and focused on working on some of the actionable points that are raised in that report. And so for other institutions, individuals, networks that are ready to support women, I think that's a very good place to start, to actually look at some of those findings in the report and see exactly where your voice can be and where your action can actually be placed. So yeah, thank you so much, Akona, and I hope that was sort of wrapping it up for us today. Thank you so much.
Thank you, Margaret. Excellent. No, it was brilliant. And thank you very much. And I'll just say to the participants, if you want the full report, go into the Women Lift Health website and also just go through LinkedIn. I'm sure we've shared it a number of times before this LinkedIn Live to see the full report, understand the barriers, understand the enablers, understand the opportunities and the actions that Women Lift Health will probably be undertaking within the next 5 years so that we make sure that they are implemented. Just to say thank you to our panelists. Thank you so much for your great insights. The past participants also thank you. So I would like to thank you on their behalf as well, but also thank the participants who were also so engaging and being part of this discussion. Until 5 years' time, and when we bring you back in and we check if everything has actually worked the way we would want it to work. Thank you very much.